Venepuncture, the process of collecting blood from a vein, is a cornerstone of modern medicine. It's especially crucial for haemostatic tests, which evaluate the blood's ability to clot. These tests are essential for diagnosing bleeding disorders, monitoring anticoagulant therapy, and ensuring safe surgical procedures. Accurate results hinge on a carefully performed venepuncture. Improper technique can compromise the sample, leading to inaccurate results and potentially impacting patient care. Hemostatic tests rely on the delicate balance of clotting factors within the blood. Even slight variations in the sample collection process can skew these factors. This can lead to false positives or negatives, potentially delaying treatment or causing unnecessary anxiety. Therefore, understanding and adhering to proper venepuncture techniques is paramount for any healthcare professional involved in blood collection. Before beginning the venepuncture, it's crucial to assemble the necessary equipment. This includes gloves, a tourniquet, alcohol swabs, appropriately sized needles, and collection tubes specific to the required hemostatic tests. These tubes often contain anticoagulants, which prevent the blood from clotting prematurely. Equally important is proper patient preparation. Begin by clearly identifying the patient and confirming their details to avoid any mix-ups. Explain the procedure to the patient, addressing any concerns they might have. This helps to alleviate anxiety and ensures their cooperation throughout the process. Choose a comfortable position for the patient, usually with their arm extended on an armrest. Applying the tourniquet correctly is essential for successful venepuncture. Place it about 3 to 4 inches above the intended puncture site, ensuring it's snug but not too tight to avoid excessive discomfort. The vein should become prominent, making it easier to locate. Next, select a suitable vein, typically the median cubital vein in the crook of the elbow. Cleanse the area thoroughly with an alcohol swab, using a circular motion moving from the center outward. With the bevel facing up, insert the needle at a shallow angle, aiming for the center of the vein. Observe for a flash of blood in the needle hub, indicating successful entry. Once the required amount of blood is collected, release the tourniquet before withdrawing the needle. Apply gentle pressure to the puncture site using a gauze pad to prevent bleeding. Immediately invert the collection tubes gently several times to ensure proper mixing of the blood with the anticoagulant. Avoid common pitfalls that can affect sample integrity. Discard the first few drops of blood when collecting samples for certain hemostatic tests, as they can be contaminated with tissue thromboplastin. Avoid excessive probing or forceful aspiration, which can cause hemolysis, the rupture of red blood cells, leading to inaccurate results. Finally, label all samples clearly and accurately at the bedside to prevent any confusion.